Health Matters with Karen Key.
Well, if I asked you which health issue affects an estimated 7.6 million South Africans, chances are you'd say HIV/AIDS. Well, you'd be wrong. The correct answer is bladder weakness, which affects 1 in 5 women and 1 in 10 men. That's about 5.2 million women and 2.4 million men here in South Africa who are affected by a condition that no one wants to talk about. Well, we're talking about it tonight with Dr. Margaret Fockema, and she's a medical doctor and president of the Continence Association of South Africa, and she's also the vice chairman of the Enuresis Academy. Good evening, Dr. Fockema. Welcome to the show.
Good evening. Good to be speaking to you.
This is, as I keep saying, one of those things that people just don't want to talk about and suffer in silence, basically.
No, it's absolutely something that people shy away from. Don't easily admit to having this condition at all.
Now, one of the biggest myths, I think, around bladder weakness is the fact that it's, well, I'm getting old and so it's a natural part of aging. But it's not, because it can affect people of any age.
No, well, if you think of little children with bedwetting, that's a form of incontinence. So right through from your 3, 4, 5-year-old to your aged person. So it's not actually part of aging. It's a symptom of an underlying problem, and we should treat it.
I was going to ask you, what are the possible causes of something of incontinence?
Incontinence is divided into different causes. If you look at stress incontinence, that's where we have a weakness of the actual pelvic floor. So the muscles weaken, and when you cough or sneeze, you actually increase your intra-abdominal pressure, which then causes a leak. So that is more a question of weakness. We call it stress incontinence, but it's not stress or anxiety. It's actually weakness of the muscles, so you can't keep your bladder closed. Then you get what we call urge incontinence, and that's due to an overactive bladder. So during the filling process, instead of the bladder just filling like a balloon that we're blowing up, the bladder suddenly contracts. And that contraction is an uninhibited contraction. So it's not a normal thing that's happening during the filling process. And if that contraction is strong enough, you will actually leak urine, or you'll have a very, very strong urge to go to the toilet. So a lot of people that are running up and down to the loo every 10 minutes or every half an hour will tell you, I have a weak bladder or I have a small bladder, but they actually have a overactive, or maybe it's easier to understand as an irritable bladder. And those we mostly treat with medication, but there are exercises. But there are also quite a lot of things that cause incontinence that are not permanent. For instance, if you have a urinary tract infection, that causes irritation of the bladder with leaking, and as soon as you treat the infection, the incontinence goes away. There are quite a few drugs on the market that we use to treat other things like high blood pressure, which can cause incontinence. Some of our antidepressants cause irritation to the bladder. So there are lots of things that could cause it, so you need to actually go and find out what the underlying cause is.
And what about changing our lifestyle and our diet? Would that have any impact on this?
Absolutely. If you're overweight, you're putting extra pressure onto your pelvic floor, so you're more likely to develop incontinence. So a good healthy lifestyle with a normal weight would be very beneficial. Lots of foods that we eat also cause irritation to the bladder. So if we're drinking a lot of coffee or any other products that have a lot of caffeine in, like chocolate, that can cause irritation to the bladder. So we need to avoid irritants to the bladder if we have a little bit of a irritable or overactive bladder.
I know a lot of women start off having the problems with the incontinence when they're pregnant, and with childbirth, that's around that sort of time in their lives. But then a lot of times it doesn't get better. Why is that?
Well, there's a few things that play a role there. First of all, genetics. So if you inherit good muscle structure from your parents, you're less likely to develop incontinence. But during pregnancy, the muscles stretch, the ligaments weaken slightly, and also the increased pressure that you have of this baby pressing down on the pelvic floor does cause incontinence. So just the pregnancy in itself can cause the incontinence. But if you do pelvic floor exercises prior to actually giving birth and strengthen up those muscles after giving birth, you can often prevent the incontinence from being a long-term problem, and it might just be for a few days after the actual birth process. So it doesn't have to be permanent.
Okay, so it's not, well, it started now. There's not a case of, well, that's it now. It's going to be like that forever.
Not. No, and there's a lot that we can do to strengthen up that pelvic floor so that after you've actually given birth, if it's a natural birth, that you can go back to being pretty normal.
Now, it's another one of those conditions where more women than men are affected by this. Why is that?
Well, partly pregnancy. That's probably one of the most obvious causes, because obviously the whole pregnancy and birth process can cause damage and does stretch the tissues. But also men have two sphincters. So they have a muscle that closes off the bladder above and below the prostate. So that gives them genetically less likelihood of developing incontinence. But as people age, and we find that men and women over the age of 60, we start to get more and more people suffering from overactive bladders with incontinence, and we find that equalizes out. So over the age of 60, it's not a question of more men or more women anymore. We actually start to find more and more men suffering from the problem.
The other problem a lot of people suffer from, I think it's called nocturia, where people tend to wake up, twice or more times during the night to go to the toilet. Is that also a sort of more women than men that would do, and does it get worse as you get older?
We actually often find that men have more nocturia than women, and that's because of the prostate gland, and the prostate gland enlarges as you get older, and as the prostate gland enlarges, it puts a little bit of pressure on the urethra, so the urine can't flow that easily anymore. And that's where men start to develop overactive bladders. Their bladder capacity gets smaller, and they're getting up to go to the toilet at night because their bladder just can't hold that much anymore.
There is also the concern people need to be aware, I think, is if you are getting up quite a lot at night, you need to be checked, because it could also be a sign of diabetes.
Yes, that's very important, because diabetes causes frequency of urination, so you would be going to the toilet more frequently. And if you are going to the toilet more often than previously, it's always a good idea to check it out to make sure what the underlying cause is. Don't just expect, because I've got older, now I'm going to the toilet more frequently.
There could be something else.
Absolutely. Yes.
One of the things, though, for people who do have this problem, though, is that they think, well, I shouldn't maybe drink too much liquid. And there is a concern, though, about underhydration. It's almost as much of a factor as overhydration.
No, it's a huge problem, because normally people try and manage the incontinence by drinking less and less, because if there's nothing in my bladder, then I can't leak. But actually that concentrated urine can actually cause more problems. That it's very irritating to the bladder, so it would aggravate an overactive bladder. And the other thing is, if you're underhydrated, you also are not in a good state of health. We need to have a certain amount of fluid to keep our body going. And if you dehydrate, then you develop constipation, and constipation then causes bladder problems as well, because if you think of the anatomy, the bladder is lying on top of the rectum. So if you're constipated, that big stool in the rectum causes irritation to the bladder, causing an overactive bladder, or it can actually cause an obstruction so that you can't actually pass your urine, and urine stays behind in the bladder, causing bladder infections. So it kind of have a vicious circle.
Obviously, if you do have this problem and you are having to get up frequently at night, possibly how long before you go to bed should you stop drinking anything?
Preferably you should actually drink throughout the whole day. So not specifically have a cut-off time that I have to stop drinking at 6 o'clock or I have to stop drinking at 8 o'clock. We normally say a good idea is to have something to drink at each meal and something to drink in between meals. So you're drinking approximately 6 glasses of fluid a day. And not actually, because a lot of people don't drink during the day and then they're very thirsty and they'll drink a whole lot of fluid in the evening. And obviously if you drink a liter of fluid before you go to bed, you're going to have to get up.
Absolutely. So you just think about it a little more. If you in moderation throughout the day, you should be okay.
Yes, that should be a good way to do it.
Now, what can people do to help themselves, Dr. Fockema? Because, people that have this condition, it is an embarrassing condition. A lot of people find it very embarrassing. How do we actually control this? What do we do in our daily lives, effectively?
Okay, firstly, have it checked out. Make sure what the underlying cause is and find out what type of incontinence you have. And then depending on what type of incontinence, you'll be treated either with exercises, with surgery, with medication. But from a day-to-day basis, while you're waiting for treatment to kick in, we need to also be able to keep our clothes dry. And a lot of people go out and they buy sanitary towels and use those as incontinence products, which is, they're not actually made for incontinence. And there's some very, very good incontinence pads available. And the problem is they're hidden away in the shops because it's a secret disease. Nobody wants to talk about it. So people have to go and look for the pads, or they're not sure where they are. And you actually get tiny little pads that are like a panty liner that absorb up to 52 mils or more. So if you've got a slight leak, you could wear a panty liner, but not a panty liner that you would use for a period. Actual incontinence pad that has been designed to absorb the urine, and it also helps to absorb the smell. And then depending on how much a person leaks, you would then use a slightly larger or thicker pad.
What about for men, though?
There are pads available for men as well, and they're also shaped differently to your female pads, so they're actually comfortable to wear and very effective.
And if I'm not mistaken, TENA, I think, makes these, TENA, TENA?
That's right, they do. They have a very good incontinence.
I have actually seen them in the shops. They're not in your face when you walk into the shop, but they are there. You just have to possibly look for them.
They are there, and people are shy to ask because they see pads and, okay, which one should I use? If you look carefully on the incontinence pads, they have little teardrops, and they color in 1, 2, 3, or 4. So the heavier the actual leak is, the more teardrops will be colored in. So if you have a very slight leak, you're going to take something with 1 teardrop. If you have a heavy leak, you're going to take something with 4 teardrops, for instance. So it's an easy visual aid so that you don't, if you're very shy about going and asking somebody which one is actually appropriate for me. What we often find is people will go and buy nappies when they actually could make do with a simple pad.
So it doesn't have to be that traumatic. You can. These products are going to make your life a whole lot easier.
Oh, they do, and they're very comfortable to wear, and they're very, very absorbent. So you don't have to be frightened that if you do have a leak that it's going to show on your clothes.
Now, we mentioned, I think, a little bit earlier about treatment, and you said we can actually help ourselves, things like exercises, changing our diets, habits possibly, doing those kinds of things. What about medications or, possible surgery in certain cases?
Yes, there's definitely a place for surgery, and those will be your like stress incontinence. And what they do is they actually put like a sling underneath the urethra, which supports the urethra. So when you cough or sneeze, you actually don't leak. That's a very successful surgical procedure that is done. We actually, in patients who don't react well to medication, we've started to put Botox into the bladder. So it's not just for the wrinkles. And that also works very effectively. So there's a whole range of options available, from surgery to tablets that relax the bladder muscle, to tablets that make it easier to pass urine, to, as I say, Botox.
So there are options. There is help out there. You don't have to suffer in silence. Just speak to your doctor, and I'm sure there's something or someone will be able to help you.
Absolutely. If we can't cure it, we can definitely manage it.
Well, at least it's given, I'm sure, a lot of people a whole lot of hope out there. Dr. Fockema, thank you very much indeed for joining us on the show this evening.
It was a great pleasure. Thank you for calling.
Dr. Margaret Fockema is a medical doctor and president of the Continence Association of South Africa. She's also the vice chairman of the Enuresis Academy. And if you'd like more information on this topic, you can take a look at the website, www.TENA, TENA.co.za, and they also have a helpline if you'd like to call them. It's 0860 763 377. So it's 0860 763377.